Welcome to treatment group video for depressive and bipolar disorder. I will be presenting for diagnosis, disruptive mood dysregulation disorder. My name is Dr. Adrianna Medina. My client's name is Cory Foxworthy. He is 16 years old. Differential diagnosis is bipolar I disorder, which was ruled out because he doesn't have manic episodes. And we also have disruptive mood dysregulation disorder, which was ruled in. Primary diagnostic features are he must be older than 6 and less than 16 years of age to be diagnosed, and must exhibit sorry must exhibit persistent irritability, anger, and temper outbursts that are out of proportion 3 or more times a week for at least a year. Okay, so Cory is being evaluated for his chronic anger issues, which were severely impacting his school, family, and social life. Cory is currently a sophomore in high school. He's the youngest of 3 children, and his parents have been happily married for 22 years. His older 2 siblings do well in all areas. Cory has always been a challenging child, according to his parents. When he hit the terrible 2s, he had bad temper tantrums, not like normal children would. He never seemed to really grow out of his temper tantrums, and the slightest little things would set him off. Every day, he would have some kind of meltdown. When they asked his mother to describe an incident, she talked about a favorite program that was always scheduled at 8 p.m. and was like just put was backtracked for breaking news. While it is understandable that he would be disappointed, his reaction was over the top. He started screaming and yelling how unfair it is. He would cuss. He started throwing couches and pillows around the room, knocking over lamps and breaking it. He just would continue to throw things. His tantrums went on until he finally went to bed at 10 p.m. His parents have learned that trying to help him during these tantrums was just a waste of time. The best thing is to keep him isolated in his room so that his disruption is minimized for the rest of the family. When he isn't throwing tantrums, he's really like irritated. Um, his mother, oops, his mother shares that everyone walks on eggshells around the house because they never know when he's gonna start throwing these tantrums or when his temper's gonna go over the top. His father says with tears in his eyes, the boy knows only one emotion, and that's anger. He's my son, and I love him, but I can't say that I really like my son. He makes it very difficult. Let's see. His tantrums is not limited to only at home. He throws these tantrums regularly at school, and he has been placed on detention frequently, usually 2 to 3 times a week. He's been suspended twice. His parents have worked very closely with his school counselor, and they have been unsuccessful in reversing these behaviors. Um, the It is upon the recommendation of the school counselor that Cory is being brought for evaluation because he is constantly angry. Um, Cory has no friends. Each time he makes new friends, the friendships last for a very short time because no one is willing to put up with the ill treatment by Cory. Teachers cringe when they see Cory's name on their class roster because they know that they are going to be challenged on a daily basis trying to manage Cory and his anger and his negative moods. His tantrums are disruptive to class, which um, are disruptive to his classmates. Academically, he earns C's and B's, but he and when he takes tests, he usually earns A's for the test. Multi-Axial Diagnosis on Axis 1 is Disruptive Mood Dysregulation Disorder. Axis 2 is none. For theoretical perspectives, we have one, which is the biological perspective. The client's symptoms may be due to genetic disposition. Abnormal brain structures may affect children with the disorder. Abnormality of neutral circuitry is thought to account for these behaviors. The children diagnosed with disruptive mood dysregulation disorders are subject to negative feedback when they exhibit a lack of activation and emotion, attention, and rewarding processing. Disruptive mood dysregulation disorder affects the brain region of the left amygdala, parietal cortex, and flexibility of attention is reduced when frustration appears. This may add to defects in emotional regulation within children of disruptive mood dysregulation disorder. And that's all for my video. Thank you.